40,000 beekeepers?
It's difficult to say. We have
About half.
we think we probably. I may have been over-egging the pudding with the numbers of beekeepers. We think we've probably got about 70% of beekeepers on there, maybe.
Man har nok cirka 70% af de avler registreret. Men bipest bruges som værktøj i forbindelse med planlægning af registrering af undersøgelser.
England and Wales is split into 8 regions, so 7 in England and Wales is the 8th. And we have about 60 inspectors, and they can use bpest to plan their inspections, and they carry out something like 30 to 40,000 individual colony inspections per year.
England og Wales er helt 8 regioner, der er cirka 60 biinspektører, og de bruger bpest til at planlægge deres inspektionsprogram. De udfører i alt cirka 30 til 40.000 undersøgelser i vilkårene hvert år.
So, if I show you this how we would when we find a case of European foul brood, how we would plan our inspections around that. This represents an infected apiary.
Og det her illustrerer så, hvorledes man laver en risikovurdering i forbindelse med planlægningen af undersøgelserne. Det her repræsenterer så en bigård.
We will put that into bpest, and bpest will generate a list of all the beekeepers within a 3-kilometre radius of that apiary, which are classed as red and high-risk apiaries. Our inspectors will then go out and inspect all of the apiaries in that 3-kilometre radius.
Man putter så data ind i bpest og finder ved hjælp af dem alle de registrerede biavler inden for en 3 km radius, og inspektøren vil så undersøge de pågældende bigårde.
And then moving out, we have amber, which they're still at risk, and that's up to 10 kilometres. So if our bee inspectors can clear the red area, they will move into the amber area, which are still at risk. And then outside of that, we have green, which are low risk or not at risk. And if the bee inspectors manage to do all of their inspections in the others, then they will look at these. That's how we prioritise the inspection.
Man har så et 10 km radius, hvor man fortsætter undersøgelserne for at finde eventuelt flere spildkilder, men hvis ikke man finder noget der, så kan man eventuelt gå ud og fortsætte undersøgelserne ude ved brænde.
So I'll talk a little bit about about what happens when a bee inspector finds European foul brood in the field, how they do the diagnostics. Most of our diagnosis is now done in the field using the Vita Europe lateral flow devices, which we developed with them about 10 years ago now.
Lidt om, hvad der sker, når man så finder europæisk bipest. Først noget om, hvordan man laver diagnose ude i marken. Det sker ved det her testkit, som er udviklet af Vita sammen med National Unit for cirka 10 år siden.
We have a kit for both AFB and EFB, but they work on the same principles. It's based on... It's based on antibody technology. It's very much like a pregnancy testing kit. We've done validation, so we're very happy. They work in the field. They're very simple to use. You take a piece of the disease material, put it into the buffer bottle, which has a liquid and some ball bearings in there, and you shake it, and then you...
Det er selvfølgelig testet og afprøvet i marken. Man tager en lille prøve af det mistænkte materiale, putter ned i flasken, hvor der er en væske, som så ryster det.
And you take a drop, place it in the well, and it runs through a membrane, and you have a colour change to tell you whether it's positive or negative.
Så tager man en dråbe og putter ned i det runde hul på testpladen, og det vandrer så gennem membranen og giver en farvereaktion, hvis sygdommen forekommer.
So you have a test line and a control line.
Og der har man så en linje for et resultat, og så har man en kontrollinje, der viser, om systemet har virket overhovedet.
So the control line is just to show that the kit has worked properly, and if you get 2 lines, that's positive.
Kontrollinjen den er kun til at vise, at apparatet har virket, og får man 2 linjer, så er det tegn på, at sygdommen forekommer.
Most of our diagnosis is done like this in the field, but if we're not sure, or if the beekeeper wants confirmation, or if there's something not quite right, then it can be sent into the laboratory, and we'll do using traditional microscopy methods.
De fleste resultater kommer fra den her type test ude i marken, men hvis der er et eller andet, der ikke helt fungerer som det skal, eller hvis biavlerne ønsker det, så sendes en prøve til laboratoriet for at ske en endelig undersøgelse.
Now talk about what happens when we do find it and when we have a positive diagnosis. Talk about the different options. Basically, we have 3 options that we use now: destruction, shook swarm, and antibiotic treatment.
Og lidt om, hvad man kan gøre. Den har i øjeblikket 3 muligheder. Den ene det er destruktion, afvejning. Den anden det er omsætning, og endelig så har man antibiotika.
The first option, destruction, is recommended if colonies are weak or very heavily infected, or colonies that have previously been treated with antibiotic and it seems to have failed. They will be destroyed.
Den første mulighed, afvejning, destruktion, det kan bruges, det anbefales, hvis man har svage, stærkt angrebne bifamilier, eller hvis bifamilier tidligere har været behandlet med antibiotika, og sygdommen så er vendt tilbage.
It's also a choice. If the beekeeper wants to destroy his colonies, that's fine. It's up to him. But basically, the colony is closed up when the bees have stopped flying. Petrol is poured into the top of the sealed colony, kills them very, very quickly. And then all the frames and the bees and the movable frame parts are burnt in a big pit. We normally get the beekeeper to dig the hole, and the inspector supervises.
Biavlerne kan vælge destruktion, afvejning, og det foregår ved, at man lukker for bifamilien om aftenen, når bierne holder op med at flyve. Man slår bierne ihjel med benzin, og så brænder man bier og bevægeligt rammemateriale i et hul, som man normalt får biavlerne til at grave, mens inspektøren så rådgiver om.
The wooden boxes are flamed with a blowtorch. Now I know that's probably not going to work with your hives because many of you use polystyrene hives. So some beekeepers in the UK are now moving to using polystyrene. So we've looked at using disinfectants, so that's a possibility.
Og det vil nok ikke rigtig virke med fodløbsstederne, hvor jeg så til folk, at det virker faktisk rigtig godt. De her engelske biavlere er ved at gå over til plastikstederne nu, og man er i færd med at undersøge mulighederne for anvendelse af rengøringsmidler. Desinfektion.
Our preferred option is for the beekeeper, other than destruction, is for them to carry out a shook swarm. You're probably familiar with this. It's based on the fact that most of the disease material is within the combs, so all of the old combs are destroyed and the bees are shaken onto new foundation in clean boxes and they're fed sugar syrup.
Muligheden for at lave en omsætning, fordi det meste af smittet, det smittende materiale findes inde i tavlematerialet. Så det vi gør, det er, at man destruerer tavler med infektion, og man ryster bierne over på ny boks i rene kasser, og så fodrer man.
And we get very good success rates with it. In fact, we get lower reoccurrence of disease using shook swarm than if we do using antibiotic.
Og der er rigtig god effekt af omsætningen. Man får lavere reinfektion efter omsætningen, end man gør i forbindelse med anvendelse af antibiotika.
And finally, the more traditional method that has been used in the UK is antibiotic treatment using oxytetracycline, which has to be done under prescription treatment, which we apply to the veterinary laboratory agencies, and it's 1 gram is fed, 1 gram of active ingredient is fed in sugar syrup to the colony. So it's put into the frame, shaken onto the frame here, mixed up, and then that is put next to the brood.
Og så det, der har været den traditionelle metode, det er anvendelse af antibiotika, et gram oxytetracycline blandet op i sukkeropløsning, og så rystet ned på en tavle, som anbringes op af byggelejt.
We try not to use it, but sometimes it's the best treatment if it's the end of the season when it's too late to carry out a shook swarm. So we would treat at the end of the season and then encourage the beekeeper to do a shook swarm in the spring.
Man anbefaler det ikke, men samtidig så foretrækker biavleren det, og hvis det er i slutningen af sæsonen, hvor man får sent at lave en omsætning, så kan man gøre det, og så anbefaler biavleren at lave en omsætning på foråret, når bierne kommer i gang igen.
We show you our numbers of disease incidents. So this is over the last 10 years. We have something like an average of somewhere between 600 and 700. We have a couple of blips up and down, but around about 600-700 mark is the average.
Forekomst af bisygdomme, europæisk bipest, har man fra cirka 600-700 tilfælde hvert år.
And I'll just show you the distribution that we have in England and Wales over the last 10 years, and I'll show you just a quick thing.
Et kort, der viser noget om udbredelsen inden for de sidste 10 år.
So you can see each year how it changes.
Og I kan se, hvordan udbredelsen skifter fra år til år.
And that was the last year, 2011. So you can see there's been a bit of a creep north, whereas once upon a time, northern beekeepers didn't think they had it, but they do.
Og man kan se, at den ligesom har bevæget sig nordpå, hvor de avlere nordpå, de troede faktisk ikke, de havde det, det viser det så har.
I think this is interesting. This goes back to 1952 up to present day, and shows this is the proportion of European Fabredoon colonies. And I'll show you, this is how the treatment methods have changed over the years, and you can see how it's affected the numbers we have.
Og her har vi så data helt tilbage fra